Hey everybody, welcome back to my channel. It's Dr. Yogi here, and if you are new to my channel, I am a family medicine doctor who went on to do a fellowship in surgical OB, so that way I can do C-sections and in addition to my vaginal deliveries. So I'm at the very end of fellowship, and I just wanted to post this video as an update on what's going on. I'm currently at clinic precepting some residents, but I had a moment, so I said, let me just get on and do this update video. So as you all know, it is the end of fellowship. I mentioned that in my last video. So I'm really excited about that. So what's next for me? What is happening next? So what I am doing is I accepted a job in Virginia. So I will be moving there with my husband and my little doggy. We are so excited. I'm excited to be in a house. We did buy a house. I'm just not an apartment life person, but shout out to everyone who is. I'm very happy to have a home and a place where I can garden and all of that. But so what this job entails, it's actually interesting. It's two different contracts. I have my main contract. It's our FQHC. And so with them, I will be seeing patients a couple times a week, and then I do a 24-hour call for OB coverage. They actually do a reverse call. Most people do their call schedules, starting in the morning, and then you go 24 hours and you end in the morning. They actually do theirs from 6 p.m. to 6 p.m. the next day. So, you're on call overnight, and then you go and complete the entire day, and then you switch. So it'll be like that once a week, and then there is a weekend call that I will go in to cover the hospital anytime there is it's like a couple times a year. That's what it equates to. So you can take call from home, so I'm really excited about that, but I think for the first couple of months I'll probably just take it in the hospital until I kind of get my how things are going to work, get my rhythm. So in addition to the call and clinic, as far as I know, I'll be able to do ultrasounds, which I'm really excited to keep those skills, to be able to do dating ultrasounds, as well as growth scans, and then limited scans where you kind of just look at the baby's heart, the placenta placement, and then the fluid around the baby. So I definitely want to keep those skills up, and as far as I know, they've granted me those privileges. And then in the hospital, I will be able to do C-sections as well as vaginal deliveries. I will have my OB backup, so there'll always be someone if there's like a really difficult surgical case or there's some issue that I need to call my backup in. They will be available to me, and they should be within 15 to 20 minutes of the hospital as a part of my contract. So I'm really excited about that. Then the second component of this job is working with residents. So I'll be working with a residency. I'll precept about 4 hours a week. And the precepting initially will probably start out with general medicine, general family medicine, and OB. But eventually they want to kind of just send all the OB patients to me because I'd be the only provider within the residency that does OB care. So I'm excited about that, as well as gyne procedures like IUD placement, Nexplanon, endometrial biopsy, all of that. So I'm really excited about doing those things. But I just wanted to come on here and give you guys an update about what's coming up. At the end of the month, that's when we'll be moving. So I'll probably do another video tracking that journey and all of that. But please stay tuned. I hope that the next video I'll post would be about the suture tying that I mentioned, because I think it's just really good to just get your hands in there, get the practice, because you never know when you'll be put on the spot by either when you're on your general surgery rotation or when you're on your OB rotation as a med student, and then definitely as a resident. You just want to be ready. So it's good to learn these skills so that way you can practice them on your own, and then when somebody tries to call you out and put you on the spot, you know exactly what you're doing. So I'll post another video. We'll talk about 2-hand ties as well as single hand ties. So I will see you in the next one. Bye guys.